Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. On February 4th, 2023, we observe World Cancer Day under the theme Closing the Gap, Everyone Deserves Access to Cancer Care. Today's focus is on the diagnosis and prevention of cancers, as I'm joined by Dr. Daniele Drepaul, the acting coordinator of the Chronic Disease Unit, and Dr. Martin Campbell, the technical officer for cancers. Thank you for joining me on the program today, Dr. Drepaul.
Thanks for having me, Alicia.
So I know that cancer is one of the major causes of death. Could you give us an overview of the situation here in Guyana?
Okay, well, according to our stats, the total burden of cancers in Guyana is 141.5 per 100,000 person years. Um, we know that the mortality is very high, and cancer is within one of the leading causes of death. So we have breast cancer leading, followed by cervical cancer in females. And in the males, the most prevalent cancer we find is prostate cancer.
Okay, for those persons who are watching the program and may not know of the development of cancers or how it begins, could you just give an overview of what cancer is and how it
Okay.
develops?
So basically, what happens with cancer is that our normal cells start to divide abnormally. And this is due to certain factors like physical exposure, like the UV lights from sun ray, which will give you like skin cancer if you're exposed, especially light-skinned persons. They're urged to protect themselves by using sunscreen, using umbrellas, and these things. But this is not to say that darker person like us wouldn't get cancer too. So we have to take precautions. And there are other carcinogens like chemicals, like in the tobacco. When we smoke tobacco products, that could also cause like lung cancer, other chemical agents like asbestos. Some very old buildings, we used to use those material, but we don't use that anymore. And there are also some biological agents like viruses, bacteria, and so that causes cancer. I'm sure you've heard a lot of our campaign on HPV, which is the human
Yes.
papilloma virus. Well, that is responsible for cervical cancer. So those are some of the factors. Also, like obesity, inactivity. If you don't use enough fruits and vegetables, your diet also plays a major part.
I was actually about to ask about diet and the foods we eat.
Yeah, so basically, we urge persons to have a balanced diet. Lots of fruits and vegetable, as I said, that will provide fiber and aid in your digestion and so on. Because you know that there are different types of cancer. I just mentioned a few, but we have stuff like stomach cancer, colon cancer, cancer of the blood. There are many types to speak about.
So, is it possible? I know you mentioned biological. You're therefore saying that it is possible for somebody to develop cancer based on their genetics or somebody in their
Well,
family that would have.
yeah, if you have a genetic predisposition, maybe a first degree relative, maybe if my mom was diagnosed with breast cancer, definitely I should get screening at an early age just to make sure. You could do your self-examination at home, but it's urged within a certain age you should start your screening.
What strategy has the ministry adopted to monitor the development of cancer across the regions?
So we have been doing screening, especially this department. We're in charge of VIA. I don't know if you know what it is. That's visual inspection with acetic acid, where we look at the cervix. If there's any problem, any precancerous lesion, we tend to treat at the moment. But if the lesion is too complicated, then we refer. We also, from time to time, we also offer pap smear, and we're hoping for the future to have the HPV testing. We also do screening for breast cancer. And as I said, there are other types of cancer that we do screening from, but that is handled at the tertiary level at Georgetown Public Hospital.
Okay, what about cancers in children? I know we will soon be observing a day specifically for that.
So as I said, certain diseases or so, we do try to do our screening, but it's handled more at a hospital level because certain cancers like leukemia and these things, you need like advanced care. So you would find that GPHC has a bigger role in it. But we have a role by setting guidelines and these things, doing the overview of the management and so on.
Dr. Drepaul, could you provide basic recommendations for our listening and viewing audience with regards to prevention, cancer prevention?
Okay, well, first we urge everybody to do their annual checkup. That's the first thing. You should go to your nearest facility. If you have any complaints, you should explain it to your doctor, and he or she will send you tests in accordance to what pathologies that they think you may have. Also, lifestyle changes. We're urging persons who smoke, who drinks, to eat. I know it's very hard to just cut the habit, but we have to try.
Yes.
Right now, we have certain programs here at the ministry which we're trying to roll out, which is a cessation program, which helps persons who are smoking to stop smoke. We know it's a process. Also, alcohol consumption. We know that that's an issue within Guyana too. So we urge persons, if you cannot quit, but drink responsibly in moderation. As I mentioned before, we have to look at our diet, eating a healthy diet. That will help us live a little bit longer. And exercise, that's very important. At least 30 minutes 3 times a week. That will help. You don't have to run in these things. Brisk walking and so will help.
Thank you, doctor.
Yes, and also to please, as I would like to reiterate, do access our screening outreach programs that we have within the regions. I know that our technical officer, he is working very hard, and we would like more persons to come out and access our services.
We'll now go into an ad break and be right back with more on the diagnosis and prevention of cancers. In August 2020, the World Health Assembly adopted the global strategy for cervical cancer elimination, which includes a vision of a world where cervical cancer is eliminated as a public health problem. Cancer is always named for the part of the body where it starts, even if it spreads to other parts later. If you're unsure of what cervical cancer is, it may interest you to know that it is a disease in which cells in the body grow out of control. This occurs in the cells of the cervix, the lower part of the uterus that connects the vagina. Cervical cancer is mainly caused by various strains of the human papillomavirus, also known as HPV, a sexually transmitted infection. Some HPV types can lead to cervical cancer over time, while others cause genital or skin warts. Other risk factors may include genetics, having HIV, smoking tobacco regularly, or any condition that makes it hard for your body to fight off health conditions. In Guyana, cervical cancer is one of the second leading cause of deaths among women. Each year, approximately 121 women are diagnosed with cancer of the cervix.
Because of these high stats, Guyana is actually ranked as number 25th in the world in terms of cervical cancer incidence and prevalence. And so because of this, back in 2007, Guyana, the Ministry of Health took on a program of cervical cancer prevention program because Guyana was actually one of the countries with the highest in the Latin American region with cervical cancer rates. And so we have decided to increase awareness and to launch a cervical cancer prevention program. And back in that year, we adopted January as a month of cervical cancer awareness, really to bring awareness about cervical cancer and encourage persons to come forward to get screened and get tested.
With the adaptation of the cervical cancer prevention campaign launched in 2007, Guyana continues to utilize a three-pronged approach in order to combat and monitor cervical cancer cases.
Back in that year, we started launching the VIA screening program, and also it's a three-pronged approach. One is to increase the HPV vaccination rate because we know cancer is linked to HPV, and to get the vaccination. At the secondary level, we were doing the screening. That is involved the VIA screening and treatment. And at the tertiary level, to those who were detected with cancer, to get them early treatment and manage the cases. So that is the three-prong approach. Over the years, we have started with the HPV program. The uptake with the HPV program has not been so good over the years because we have had a lot of what we call vaccine hesitancy among the population. And this year in 2023, the ministry will actually be relaunching the HPV vaccine. We are trying to actually incorporate it in part of the routine vaccination program for school-age children, and also to push the uptake of HPV vaccine again. Because we know HPV vaccine works. It does help in the prevention of cervical cancer. That's one level. The second level is to get persons screened. More VIA centers is being set up. We need to have more persons trained and to get their persons screened on a regular basis. And at the third level is to increase access to treatment and care for those persons who have been diagnosed with cancer, cervical cancer. So we have the oncology unit at the Georgetown Hospital. We have radiotherapy available for those who have been diagnosed with cervical cancer. But we don't want to reach at that stage. But sadly, what we are seeing is that most of the persons who are detected with cervical cancer in Ghana are sometimes in late stage. And you know, this is so sad because cancer by itself is preventable and is also curable. But once you detect it very early, you can actually cure it and it can be treated. And so what we are seeing is like the late stage, and when people actually start having symptoms and so on, and then they present. By the time it's kind of, you know, it's kind of late.
While cervical cancer produces no signs or symptoms in the early stages of development, one may experience vaginal bleeding after intercourse, between periods, or after menopause. They may also experience watery, bloody vaginal discharge that may be heavy and has a foul odor, pelvic pain, or pain during intercourse in its more advanced stage. With this, it is highly recommended that women from the age of 21 get a pap test done and also repeat it every 2 to 3 years depending on the first test results. Women are also encouraged to speak to a medical professional about the HPV vaccine if you're 26 years of age or younger.
For persons, what we recommending is that one is people to stick to one partner. We know multiple partners increase the risk of HPV infection. Two is to get HPV testing done. One is something that we are actually introducing, is to start to do HPV testing to know if you're infected or not, because those persons who are infected with HPV know they're at a higher risk, and to get yourself screened on a regular basis. Because not one screening alone, you do one screening and then you're good for the rest of life. You need to do it on a regular basis. There's specific schedules for screening and you need to follow those schedules. If you screen and you keep getting negative results, you can know it's because if you detect it early changes, you can actually do an early intervention. So those smoking, we know we encourage women not to smoke because there's another additional risk factor that is related to cervical cancer. In terms of the screening, we recommended, the recommendation is that at the age of 21 you should start getting screened, because from the age of 21 that's when a lot of people will actually probably get infected with HPV before in the early age, because we know, like on the last survey that we did, before sexual intercourse among our teenage population is actually by the age of 13, and so screening internationally, you start screening at from the age of 21. If you have a negative test, then you screen you back in 3 years later. Then if after 3 years, if you have a negative, you get 5 years later. So it depends upon it. If you screen first and you're positive, well, you get back a screening and 1 year later on. So this specific schedule depends upon your results. But we're recommending that persons from the age of 21 start getting screened for HPV or doing the VIA testing.
When screening for cervical cancer, 3 methods are used to determine if any precancerous cells have developed. These include the HPV test, which checks the cells for infection with high-risk HPV types that can cause cervical cancer. The pap test collects cervical cells to be checked for changes caused by HPV that may, if left untreated, turn into cervical cancer. This will detect precancerous cells that may lead to cervical cancer. A pap test may also identify conditions that are not cancerous, such as infection or inflammation. The HPV or PAP co-test uses HPV test and PAP test together to check for both high-risk HPV and cervical cell changes. For those of you who are wondering what to expect at a cervical cancer screening, a pelvic examination is usually done, which takes only a few minutes. During the examination, the patient lies on their back on an examination table, bends their knees, and put their feet into supports at the end of the table. The healthcare provider then uses a speculum to gently open the vagina to see the cervix. A soft, narrow brush or tiny spatula is used to collect a small sample of cells from the cervix. In performing an HPV test, the sample is sent to a lab where the cells can be checked to see if they are infected with the types of HPV that causes cancer. When both an HPV test and a PAP test are done on the same sample, this is called a HPV PAP co-test. In addition, the healthcare provider usually provides insight to patients on the examination process to the patient before screening is conducted. Now, let's hear from Anna, a survivor of cervical cancer.
My name is Anna Demores. I'm 58 years old. I have 3 kids. I have 3 grandchildren. I was diagnosed with cancer of the vagina in 2018. One night, I wake up and I go to urine, and when I take the tissue and mop, I see the blood. Next day, I call one of my foundation, the Become Foundation, and I told the nurses what I have seen, and they told me to don't put my finger. Then I called my gynae oncologist, and she told me she will get on to an oncologist. I went to him, they did a biopsy, they sent one to Georgetown Hospital, they sent one to Woodlands. And the morning when I get it back, I sit at Woodlands and I open it, and I see all the red markings. I know all the things because maybe it's through the years I've been through this, so I know to read, I guess. Yeah, so my doctor, he said, don't cry. He said, you know what is happening? I said, yes. And I start one scream. I start one screaming. And they say, I have to do radiation, internal and external radiation. So they write up for me to start the radiation. And so something I have to do at the Eureka lab because Joshua Muscle never used to do it, but now they're doing especially a main test that it costs $15,000. They're doing that, the cancer marker. And so I said, where would I find this money from? I said, God will provide. So I tell my doctor, and she said she's coming and she will let us go to the ministry and put the case forward to social worker, and we put the case forward, and they pay for my treatment at the Cancer Institute. The government pay for that. I only had to find my money. I had to pay for accommodation and different things and different organizations like the Periwinkle. I could call my clubs because I wanted people to know about them. The nurses from the Beacon here, the Giving Hope Foundation, Dr. Godin Foundation, and so everyone showing my family and my church, everybody showing a lot, and they and I go to Suriname and I did the internal radiation. But before I went to Suriname, I had no cancer. The cancer was gone. But when I meet over there, the doctor say, you still have to do it because I made money already paid. You have to do it because we don't want a recurrence. Something is getting a little emotional. You don't want a recurrence, so I did my internal and external radiation from 2018 to now. I was like 3 months lying on my back in 2018 because I was badly born. But thank God that I'm here, that I have life. But all through the years, in 2008, I was diagnosed with stage 3 breast cancer. Yes, I would tell persons. I work with patients who come to do radiation, and I tell them family is very important, and friends, because I see through the years a lot of family cancer break up a lot of family. A lot of friends think that when you have cancer that they will catch it. A lot of people think that when you have cancer, they want nothing to do with you and this thing. But in my situation, no, it wasn't like that. But I would tell them to please support, please show them the love, especially if I see this person not gonna make it. I know, right? Make them comfortable. Women out there, I'm appealing to you to get early screening because some persons never even go and do the VIA. Some persons so afraid, but there's nothing to be afraid of. I could tell you, nothing to be afraid of because early detection saves life.
Dr. Martin, thank you for joining me on the program as well. You're no stranger to this program. We want to talk a little bit about outreaches that you guys would have done within the regions. Could you tell us about that? What has the response been like from persons in those areas?
So, as you know, we recently concluded the Cervical Cancer Awareness Month, January. So throughout that month, we would have had numerous outreaches throughout the country, and the experience has been very satisfactory. It's been favorable. We noticed that a lot more women are coming out to access some screening in our activities. So that's something that we hope will continue and hope will expand further. We would have visited sites in Region 7, Region 9, Region 10, along with areas along the coast. We would have been to those areas to do screening, sensitization, offer the services of VIA, as well as some pap smears, and of course, HPV vaccinations.
Okay, I'm wondering what is the screening process like for persons who would want to go and screen for breast cancer or cervical cancer, even prostate?
Okay, so for cervical cancer, the screening process is a very simple, very straightforward process. You just access the service at a facility that offers it. There are facilities throughout the country. Upon entering the facility, you can inquire from any of the staff about VIA services being offered. The VIA trained provider would usually then attend to that person in terms of providing information whether or not the person is there that day to get screened or would like to make an appointment. So they're there to facilitate that. The process itself, as the client, as we would normally say, client or patient, comes to the facility, we usually do a session of counseling. So we would inform them about cervical cancer, what it is, risk factors, and so forth. We would provide some insight into the screening process, what to expect. So it's a process in which, as you would probably know, the cervix where it's located. So to access that, the trained VIA nurse would have to do an examination called a speculum examination to visualize the cervix. So all of that process is explained in detail to the client, so to alleviate any fear or concern that they may have. One of the things that is often asked is if vinegar, because if it burns, if the process hurts. Because a lot of people think, when as soon as they hear about vinegar, they think it's something that is going to cause them harm. So that is something that we try to talk about to dispel that myth. It's a simple process. The time in general, it takes about 10 minutes or so from the person entering the room to completing the process.
I know generally people usually wait until something is wrong and then they visit the health center or even the hospital. So I'm very glad that you're providing this information so that they know that the process is very easy, it is very simple, and there's definitely nothing to worry about. With regards to sites, what are some of the sites that persons can actually go and get screened?
So we have, like I said, we have sites in all 10 administrative regions. I'll just name a few from each region so that we can, it's quite a few. So in Region 1, we have the three main districts. You have the hospitals, so that's Mabruma Hospital, Port Kaituma Hospital, as well as Maruka Hospital. In Region 2, there's screening at Sadi Hospital, at Charity Hospital, as well as Anna Regina. Region 3, currently there is only screening at the West MRI Hospital, but soon, before the end of the first quarter, so that's March, we should have screening up and running back at Lenora Hospital as well as Perica Health Center. In Region 4, there's the VIA clinic at Georgetown Hospital that works Monday to Friday. There is VIA screening being done at Dorothy Bailey Health Center, South Road Health Center. We have services at Kitty Health Center, at Industry, at Sophia Health Center, as well as the NCTC, National Care and Treatment Center. We also have screening at Diamond and hopefully in the near future at Edmore and CC Nicholson on the East Coast. In Region 5, we have screening being offered at the Maiconi Hospital, as well as before the end of this first quarter, we're hoping to get back services up and running at Fort Wellington, as well as at the Rosignol Health Center. In Region 6, there is, like I said, New Amsterdam, the major hospitals, health centers, New Amsterdam, Skeldon. There's the Bohemia or Women's Health Clinic, as well as Cumberland Health Center. Region 7, Bartica and Cameron are offering services currently. Region 8, mainly at Madia, but of course that team tends to move around the region. Region 9, Letem currently, and Region 10, there is the Linden Hospital Complex, as well as the Wisma Hospital, and a few health centers within the ward area.
Okay, thank you so much. With regards to the HPV vaccine, could you spread a little awareness on that, especially for parents who watch and even adults who wish to take the vaccine?
Right. So the HPV vaccine is available locally, free of cost, at all government facilities, healthcare facilities. It's a vaccine that, as the name says, it's to fight or prevent the human papillomavirus, HPV. That virus has known to cause cervical cancer, and studies are being shown that to state that the virus may have a role in breast cancer as well as prostate cancer. So that vaccine, like I said, is free of cost. It's available. We would normally say target the more vulnerable group, or the group that is most beneficial for, which is the younger male and female, from age 9 to 16 years of age. So we also offer that service to women as old as 45 years of age currently. That's dependent on certain factors. Of course, they should be HPV negative.
Dr. Martin, for persons who would have been diagnosed with cancer, what treatment is available for those persons?
So once the diagnosis of cancer is made and staging and all of that is made, your oncologist would indicate usually one of three, or starting with one of three types of treatment available here. So of course there's chemotherapy, which is using various chemical substances, drugs, to destroy the cancer cells or the cancerous parts. There's also radiotherapy, which is, as the name says, using radiation to also destroy cancerous cells. And in some cases, surgical removal of masses and so forth that haven't spread or haven't begun to spread. So that largely depends on the type of cancer, the location, the grade, the general health of the person. All those factors play a role in which which combination of treatment is used and how it's used. So those services are generally available through the public health system. So chemotherapy and the various surgical interventions can be done at Georgetown Hospital free of cost. Radiation therapy is done or offered through the Cancer Institute of Guyana, and that's with some amount of subvention from the government to help to alleviate some of that cost.
Dr. Martin, before we wrap up today's program, do you have any remarks for our viewing and listening audience?
I would just like to encourage the general public to ensure that they are routinely checked, routinely have a relationship with your nearest healthcare provider, someone you have a trusting, open relationship with, in terms of, doctor-patient relationship. So just ensure you get your checkups annually. If you know any family member or might have heard of any family member having had cancer, that's a reason for you to take even more precaution to check on yourself and encourage your other family members to get checked as well. There's screening available. There is vaccination for HPV available free of cost. And, cancer is a thing that it's better to know early than late, because, the earlier you find out, the better the options of treatment and survival rates are. So, it can be a little daunting, but just take that, your health into consideration and go out there and find out, make sure that you are in the best of health.
This has brought us to the end of Health Matters for today. Thank you, our listening and viewing audience, for staying tuned with us. I'm Alicia Martin saying goodbye for now.